Hi, this is Angela Hamilton, and I'm going to be doing a video over COPD for Dr. Dana Seeley. And sorry, this is a mess because of group walks. Okay, let's get started. COPD, many of us know what it is, but we're going to break it down for you in this presentation. So first, what does COPD stand for? It stands for chronic obstructive pulmonary disease. Now, what it is, it's a progressive disease. It makes it really hard to breathe. So if you can imagine feeling tightness on your chest, shortness of breath, a lot of mucus, a lot of coughing, it's called the smoker's cough typically. That's when you really hear it, and it can be fatal. Unfortunately, it is an uncurable disease. They don't know if they'll ever find a cure for it. However, it can be prevented, and the root cause of COPD is smoking. Smoking is, if you know someone who smokes, you typically, what do you hear? You hear that coughing, you hear that mucus, you hear everything that sounds bad, that you know if their lungs are getting blocked. So eventually they could be possibly setting themselves up for COPD, and chances are they probably will. Here's the scary thing about it, is that over 24 million people don't even know if they have it. 11 million people have been diagnosed with COPD. 11 million people. When I read that number, I couldn't believe it. I couldn't believe that so many people know what it's caused by, but still don't want to take the steps to prevent it. However, it can be prevented, like I said, and the craziest thing that I really did learn from the American Lung Association was that it is the third leading cause of death. When you think of death, I think of things that you don't have control over, like there's some cancers you can't prevent, you can't prevent car wrecks or anything like that. So to know that you're doing something that you can prevent, but it's the third leading cause of death, means we need to wake up in the US a bit. But, so moving on, now you have COPD. Let's say, for instance, you have COPD. What's going to happen to you? First, you're going to develop symptoms. These symptoms are going to be very severe, and you're going to start seeing it a lot with your breath. You're going to start noticing that you're not going to be able to run like you did when you were a kid, or exercise like you did when you were 20, because now you've damaged your lungs. So the doctor typically, there's so many medications out there for it, and what they're going to do is they usually prescribe inhalers, and what it does is they relax your airways. So when they relax your airways, and there's two ones, there's a beta agonist and a name that I have a hard time pronouncing, anti-inflammatory. Sorry, Dr. Seeley, I'm not good at pronouncing names. But what they do is it makes it easier to breathe through an inhaler, and if it's really severe, then they'll prescribe a steroid. All the steroid is there for is it's going to reduce the airway inflammation. But now when you're talking about anti-inflammatory, they can have a lot of effects such as diabetes, osteoporosis, and risk of infection. When you have any type of disease, you're automatically setting yourself up for other risk factors. Like, people don't realize when you have a disease, you're going not just with those symptoms, you're setting yourself up for a chain of reactions. And I really wish people would grasp this concept, especially with COPD. And I'm sorry I'm moving the camera a lot. I just get excited when I talk. So if I was going to train a client and they have COPD, I've got to first think about what are the precautions and what are the considerations with testing. Exercise testing with COPD is a really good thing. It has to be done safely and correctly. However, I'm gonna reference the book, and it lists so many benefits. It's flexibility due to stretching, better balance, enhance the body appearance, reduced ventilator requirement. Any form of exercise is going to help this disease. It's not going to make it go away, but it's going to delay it a lot more than what you think. A big thing is to use oxygen therapy as well during this. Another thing is you want some people there with you. You're not just gonna go when you do any exercise. It doesn't matter if it's testing or just with out to the gym. When you have a disease like this, you actually need to make sure, especially if it's severe, that you have people there. So typically you're gonna have a respiratory therapist. Respiratory therapists, they're gonna be there to evaluate. They're gonna teach you things. what respiratory therapists should do is there's a method, and it's like the pursed lips and diaphragm breathing. So you kind of have to, it's like learning how to walk, but you have to learn how to breathe all over again. And these methods, they're going to help you control your breaths and effectively allow you to breathe. They're just like techniques. A physical therapist as well as a trainer, first of all, you need to be cleared by your doctor to do any exercises. And if you have COPD, typically they're probably going to say you need to, unless you have multiple conditions. It's going to improve your quality of life. I mean, exercise, no matter what you have, always improves your quality of life. Now, here's what I can tell you. I'm going to say exercise, but I'm going to say it through the FIT VP principle, which for those who don't know what FIT VP, it stands for frequency, intensity, time, type, volume, and progressive. Progressive, or volume and progressive, just now recently been added. And we're going to go through it real quick so I can explain. So yes, of course, when it comes to COPD, there's 2 styles of training that you need to do, depending on your physical capabilities and everything. But I would recommend aerobic training. Aerobic training is just simply walking. Your frequency, 3 to 4 times a week. Get a little, what I personally would recommend is get a little exercise every single day. You don't have to brisk walk every day, but just to do some walking, no matter what condition you have, some walking, something to open up those airways, something to clear your head. It's a great thing. Your intensity, all exercises will be done at moderate level, because you can't, so for instance, I'm a runner. I can run all day. That's fine. But that's because my airways are open and they're clear. COPD, you can't do that, or else you're going to raise your blood pressure and cause all these types of problems that you do not want, especially since you're already short of breath. So we're going to keep it at moderate. And what moderate level is, so I want you, if you're walking and you're talking with someone, you're going to have difficulty breathing. The next is resistance training. Resistance training, to go back, I mean, you got your time for aerobic, 30 to 60 minutes a day. Incorporate exercises, so your volume is going to be 3 to 4 by 60 minutes. Your resistance training is going to be 2 days a week. Keep it moderate level, low reps, low weight. You're going to do this for 30 to 40 minutes. Your progressive, I want you to increase your reps twice every month. You know, and it is important to be aware that your COPD is going to affect these. So precautions, you know, make sure you have your personnel, make sure you have your people, make sure you have your oxygen, medications, take it all that's necessary, but make sure you exercise. If the doctor says to exercise, make sure you exercise. It is important to realize you have a disease that is going to change your whole life, so why not try to improve your quality of life as much as possible? And that's all I have for you. I'm already a little over 8 minutes. Sorry, Dr. Seeley, but I hope that is as well as I could explain it in the short time that I had. Thank you.